So I'm going to pause here, and we're going to invite up Ymelda Mendoza-Flores. She's a health program specialist, and Robert Herrick, our epidemiologist, and they're going to talk to you about who is experiencing homelessness in the county. So don't look at the sun.
Okay. Well, if I do, it'll be rather entertaining. So, good afternoon, Chairman Whitaker, members of the board, members of the public. I am Robert Herrick, the Sutter County Public Health Epidemiologist, and this is Ymelda Mendoza-Flores, who is a homeless outreach coordinator. And for the next 10-15 minutes, we're going to tell you about who is experiencing homelessness in Sutter County. I'm going to present you data from two sources about what information we have about people who are experiencing homelessness, and then Ymelda is going to introduce you to several of the people she has been working with and tell their stories. So, where did we get our information? We have two primary sources. The first is what is called the point-in-time count, and that's a federally mandated census of everyone experiencing homelessness. It's conducted once every 2 years. The last was on January 25th, 2017, and we have a team of county employees, members of the various organizations to help with the homeless on both sides of the river, go out and try to identify every single person who is homeless and get some information about them. And for those who were identified in Sutter County, we have created the point-in-time count data summary, which everyone, members of the board, should have, and there are copies in the back. Then, second, we have the Sutter County Homeless Outreach Project. And these are in-depth interviews. We're talking about 30 minutes between our outreach team, one of whom is Ymelda, with people experiencing homelessness. And it was people who would call the homeless hotline. They would go out to the feed at the riverbank, people they were interacting with in the parks, and try to get information about who is homeless. Part of it is a trust building so that we can begin interacting with people experiencing homelessness and figure out just who they are, why they're homeless, and what we can do to help. So this began in October of 2016, and the data you have today was when we wrapped up in August. What happened is that as part of the coordinated entry program, Sutter County, Yuba County, Hands of Hope, Salvation Army, and many of the other agencies that were sort of independently collecting information have decided to collaborate. And so we started asking additional questions, making sure we had the same questions across the river, and we haven't begun to analyze that data. So all of this is found in more detail in the data from interviews with people experiencing homelessness. So I'm going to take you through several of these slides, assuming, of course, I do not get blinded by the sun. So on January 25th, 2017, the team conducting the point-in-time count identified 760 people who were homeless. Of those, 331 were identified in Sutter County. 274 were adults, the rest were children. This is almost certainly an underestimate. We've done a few examinations of the point-in-time count data and interview data that we have, and we've identified people who are in one but not both. So it indicates that we didn't necessarily capture everyone when we were interviewing. So who is the average homeless person in Sutter County? So the average homeless person in Sutter County is female. They're 46 years old. They're Caucasian. They are not Hispanic. They're not a veteran. They live in an encampment. They do not have children living with them. They've been homeless for at least 3 years. They're a single adult. They have a high school diploma or less. They earn about $440 a month. They have pets. They have health insurance. They're from the Yuba Sutter area, and they have at least one chronic medical condition. So, how do people become homeless in Sutter County? For each of these graphs, the bars are numbers of people. And so of about the 274 adults, you can see the largest reason, almost 200 of the 274, said unemployment is why they became homeless. That's 43%. Next is unable to pay the rent or mortgage. That's 26%. And then 10%, 46 people, said mental or physical disability. And you can see some of the others there. And more detail is available in the point-in-time count. So that's why people became homeless. So why are people still homeless, recognizing the average person has been homeless 3 years? So in our interview data, that was the question we asked. What barriers are there to becoming housed? And the largest of the 177 people we interviewed, 109 said insufficient income. That's 71%. The next was unemployment and lack of housing, both of which 42 people, 27%. Okay, when we say lack of income, what are we talking about? Where do these people get money? So from the point-in-time count and the interview data, we asked, where are your income sources? And that's what you can see here. And so for about 45 to 47%, depending upon which set of data you look at, have no income at all. Of those who do have income, the most common source is Social Security, SSI. And then you get CalWORKS for about 15 people, and that is a program for people with families that provides work. SSDI, food stamps, collecting recyclables, and you can see going on. And from this, both interviews, we estimate the average income for a homeless person in Sutter County is about $440 a month. Okay. So if you're making $440 a month, what do you need to be housed? And this is data we conducted a survey of all the rental properties we could identify in Sutter County, collecting what their size was, how many bedrooms, how many bathrooms, what's the monthly rent, security deposit, and associated costs. And I know it's difficult to see on the top line, but the average apartment or rental unit, we looked at apartments, we looked at duplexes, we looked at houses we could find that rents for. The average monthly rent is about $850. The security deposit is about $670. Your application fees are about $25 and change. If you have a pet, you need about $400 a month. So your total payment on move-in is $1,400. That's approximately 4 times the average monthly income of the average homeless person in Sutter County. If you have a pet, which about half the population does, you're looking at $1,700 on hand, in cash, just to get the key to an apartment. Okay, so when we look at this data, we talk about what we call rent overburdened. And that's where, if any of you have filled out a rental application recently, they look at your income and they want you to make at least 3 times the rent before they'll rent to you. So if you spend more than that, you're what we call rent overburdened. So looking at this data, about if you make less than $3,000 a month, you're rent overburdened. To put that in context, 50% of the households in Sutter County are what we consider rent overburdened. So if you're homeless and you have about a quarter of the income you need, you really are at the very bottom of people who are available to get housing. And there's also not a lot of housing available. The vacancy rate in Yuba City is 6.9%. Countywide, it's 8%. Statewide, it's 15%. So we have, compared to the rest of California, fewer available places for people to live, whatever they make and wherever they're from. Okay, so if they're not housed, where do people who are experiencing homelessness live? And this is data from the point-in-time count. So this is January. The largest place people were living was a tent encampment. So 27% of the people that were identified on that day in January were living in an encampment. Next, 20% were living what's called an emergency shelter. That's the REST program. It's run by local churches. It's a consortium. They trade who is providing shelter at night. It's primarily for families and then women with children, which the average homeless person in Sutter County is neither, and it only runs from December to April. So if we did this point-in-time count today, every single one of those 56 people who was in an emergency shelter, that emergency shelter doesn't exist and won't reopen until December. Then the next place people were staying was a street doorway or underpass. We've got people who are living in hotels and motels on vouchers, primarily those part of our pilot project. Then it was next people living in vehicles and so on. So what other burdens do people who are experiencing homelessness have? So we asked about physical and mental and developmental disabilities. We asked about chronic medical conditions. So 77 of the 177 people we interviewed have a physical disability. Of those 177 people, 54 have a mental health condition, and 129, that's 73%, have at least one chronic medical condition. And the chronic medical conditions reported arthritis, asthma, hypertension, heart disease, cancer, diabetes, depression. And you can see, though it is a little hard to see, the proportions of the people we interviewed with each of those conditions. Of the 129 people who have at least one chronic medical condition, only 9 reported they were getting the medical care they need to manage that condition. Of the 77 people who had a physical disability, I think only 3 said they were getting the care they needed for that disability, and people with mental health conditions were, I believe, it's the last page of, it's less than 5. So we're dealing with folks who have not only an issue with income, it's not only an issue with unemployment, but it's folks who have medical needs, who have disabilities, who have mental health needs, all of whom make it very, very difficult to navigate the system of all of the services available and find a place to live and then stay in that place to live. So where do the homeless come from? And so this question we asked at the point in time count, we asked it twice, where was your last address? And we asked, where do you consider home? In our interviews, we also asked, where was your last address? And for everyone on Medi-Cal, and about 86 to 89% of the homeless population is on Medi-Cal, so they have medical insurance, we were able to figure out what county is providing that Medi-Cal. And the numbers are about the same. So what we showed here are the data from our interviews. So 105 of the 177 people, the last address they had was in Sutter County. 28, the last address was in Yuba County. 15 were from elsewhere in California, and only 15 were from outside California. And the data from the Medi-Cal is similar, that the people we identified on Medi-Cal, they're primarily Sutter County or a much smaller proportion Yuba County. And we got the same data when we asked from the point-in-time count and both ways. So this is a pretty solid evidence that at least 3/4 of the people experiencing homelessness in Sutter County are from Sutter County. They're members of our community who had something happen that caused them to lose their housing, lose their footing, and then become homeless. So for the last 10 minutes or so, I've shown you numbers. But really, who is experiencing homelessness in Sutter County? So I'm going to turn this over to Ymelda. She's been working very, very hard as part of our homeless outreach outreach program, and she's going to present you several people who are homeless that she was working with and that she's helped to give you an idea of some individual stories and faces, several of whom are here today.
Good afternoon, Chairman Whitaker and members of the board. Over the past year, a team comprised of a public health nurse, behavioral health counselor, and myself, a health program specialist, provided intensive case management to those participants in the Homeless to Housing Pilot Project. I will be sharing a few of the many personal stories of those that were experiencing homelessness in Sutter County. But who is experiencing homelessness in Sutter County? Most people aren't affected by homelessness until you are. Homelessness appears simple. No money equals no home. How one becomes homeless, how one gets stuck there, and what one experiences while homeless is far more complex. Each path into one of the homelessness, in and out of homelessness, is unique. An artist, a veteran, a musician, a medical worker. These are the stories of a few of those experiencing homelessness in Sutter County. Let me introduce you to Pan. Pan unfortunately passed away before he had the opportunity to write his story. Pan, 75 years old, had lived on the river for 50 years with no income. Pan had never applied for any benefits. As a young man, he was an artist and was featured in Rolling Stone magazine. His work was shown in San Francisco and other cities. Pan evacuated from the river during the January storms. Participated in the Sutter County Homeless Project. Pan was able to attain an income through SSI. He was so appreciative of the help he received and the income, though he only received this benefit for a few months before he passed away over these very hot months during this past summer. Let me introduce you to Lee. Lee was not able to join us today as he struggles to get around due to limited oxygen intake. These are his words. I am Lee, and this is my story. I have been homeless for a number of years with my very small income. It's been impossible to get off the streets. I saw no way out, so I went off my medication for mental illness. Things got bad on the streets. It was hard finding places where I could keep clean, finding bathrooms that businesses would allow me to use. Also, it was really hard to find a place to sleep that I could feel safe at. Regular people were nasty, like a lot of homeless people. The police would run me out of a lot of places I thought I was safe in. Then I met Roberta from the Homeless Outreach Program, and I was told I could join this program and they would help me get some housing I can afford. I just have to do a program designed for me. Part of my program was to keep taking medications for my mental illness and have a medical doctor, which in turn saved my life. I owe my life to the Sutter County Homeless Outreach Program. The PATH program helped me pay for my deposit. I almost didn't keep my appointments. The only reason I kept my doctor's appointments is fear of getting kicked off the program. My doctor had to call 911 on me because of my health. Lee is a Vietnam veteran and is now permanently housed and 100% self-sufficient. Let me introduce you to James. And James was here earlier. James is a long life, profound hearing. He has long life, profound hearing loss and is mute. These are his words. I am thankful to the people that helped me. January 2017, John, this is a friend of James, told me that a program was offering 10 days in a motel for homeless. I said yes. I was very sick and my health was bad. After 5 days in a hotel, 4 women came in my room begging me to go to the ER. I looked at Ymelda and told her to call 911. I feel so sick and not good. I went to ER. The doctor saved me. I had been in pain for a long time. I was so happy that the pain was gone. Then they, Ymelda and Roberta, don't want me to go back to the river. So I stayed at the motel. Slowly, pain goes away. I told myself not to ignore what Roberta offered me, to find a place to live instead being a camper. Also, Roberta helped me to fix my SSI. It was about to get cut. Sometimes I think about the 2 ladies helping me with my troubles. SSI, hospital, hotel. I cried that I am getting better. True, river's not a good place to stay. I rent my own room now. My home is better than the river. I want to thank Ymelda and Roberta for helping me get through all my suffering. Whew, I'm okay. I want to be healthy and happy. I have learned a lot, not to go back, just keep moving forward. Thank you very much. James is now permanently housed and 100% self-sufficient. Now I'm going to introduce you to Rodney. These are his words. I am 66-year-old veteran vet that did 2 tours in 1969 and 1973. I received the Bronze Star and 2 Purple Hearts. That doesn't make me any better than the many homeless people on the streets, but it does show I was serious about serving my country, which I did with honor. When I returned in 1973, I was lost, to say the least. Ron Brazier, who is the pastor of the River Bottoms Church in Yuba City, was sitting on the seat next to me on the way home as we landed in Oakland. People were throwing bottles at us and calling us baby killers. We were not expecting that kind of welcome. I began a life of ups and downs that included painting jobs, alcohol, drugs, homelessness. I did get my contractor's license and am a 40-year journeyman painter. I continued to make bad decisions, eventually was sentenced to the California Department of Corrections. After my release, I was homeless, and I had been at the river bottoms for 3 years when the storm hit. We were told that the county was handing out 10-day motel vouchers. The voucher was given to a man who was down on his luck and was offered the opportunity by the Homeless Project with Ymelda and Roberta to better himself and do something about his failures and step up to succeed. I am more plugged into the VA now. I have a wonderful caseworker, Lisa Welch, who got me a Section 8 voucher, and I am now moving into my own apartment in July for the first time since 1993. Also, I am taking my medicines. I am plugged into the VA mental health and regular medical help that I desperately needed. Rodney is a Vietnam vet. He's permanently housed since July and 100% self-sufficient. Now I'm going to introduce you to Dana and Ted. We met them at a local park. These are their words. On December 24th, 2014, our life changed for the worse. The place that we called home in Marysville for 15 years was sold in a short sale after the owner passed away. We had no idea on where and what we would do. We ended up putting all our belongings from a 3-bedroom home into a storage, thinking it would be for a short time. We had been staying in a van with a small dog at Sam Brannan Park during the day, and about sunset, we would move to the Walmart parking lot in Yuba City. We didn't realize how hard it was to find a place. We need to make 3 times the amount of rent. To do this, when you're on SSI and get only $1,271 per month. Thank God for Jim Leonard for serving the free lunches 3 times a week. Towards the end of December 2016, 2 women came to one of the free lunches. They were Ymelda and Roberta. When Ymelda sat down with my husband and I felt she really cared about our needs. My husband has stage 4 liver disease, and I have breast cancer. So just for someone to sit down and hear our story was very comforting, to know someone could help us. She helped us in January by putting us in a motel, and we stayed until the end of April. On April 1st, 2017, I had an emergency surgery on my left breast. We were so thankful to have a room at the motel to come back to, given that I had an open wound. Ted worked for the Appeal Democrat for 11 years and was an accomplished musician. Ted and Dana were permanently housed in May 2017. Unfortunately, Ted passed away September 19th, 2017 due to his health conditions. We are continuing to work with Dana as now she finds herself with a single income, and we do not want her to go back to homelessness, so that is our focus with her. But she's still housed and she's still 100% self-sufficient. This is Patricia. We met Patricia at a local park. These are her words. I lived 10 years at my apartment until my place of employment closed down. I worked as a pharmacy tech. I received unemployment for 6 months. In that time, I was not able to find a new job. When the unemployment ran out, I couldn't pay my rent and had to leave. I then became homeless for 3 years. In 2017, I met the Workers for the Homeless who helped me get a place to live. I'm very thankful for their help. Patricia is 75 years old, permanently housed, and self-sufficient. Next, I want to introduce you to Christine. Christine, can you come up here, please? So Christine was referred to us by a local program partner agency. Okay. You got it? Yeah. Okay. I'm going to read it.
Okay. I had a nervous breakdown between my job and caring for my mom. Took a leave of absence from my doctor's orders. When I was released, I no longer had a job. Because of no money coming in and no job, I lost my home. Lived in low-income senior housing. Then I had 2 small strokes. I went to Hands of Hope and participated in the REST program, opened from December to April. When it ended for the year, I went on the streets. After 2 months on the streets, I got sick with a bacterial skin infection and was hospitalized and spent 3 weeks in ICU. When I was released from the hospital, I was transferred to a skilled nursing facility where I spent 8 months, and I had to learn how to walk again. I still have problems walking, and I was given an electric wheelchair because I kept falling. Per doctor's orders, I am to stay off the street, so this program has been a godsend for me. Okay?
Thank you. We are working very hard with Christine to find her a permanent housing. Franklin, do you want to come up? No? It's okay, Franklin, you don't have to. So let me introduce you, Sandra and Franklin. My name is Sandra, and I am 75 years old. We lost our house to a fire August 30th. It was this year. And have been living in a motel since then. When I say we, I mean my son Franklin, who is 57. Our funds were limited, 1,600 SSI for both. We had to choose between living on the street or having food. We didn't have money for both. I used to wonder how people landed on the street. Was it by choice or circumstances? And it had to have been circumstances. I'm crying with my son. I'm crying, and my son is upset. And here comes our angels from PATH and Homeless Outreach Project. The programs and these amazing people saved our lives. They are here to help and told us it's going to be fine. We are currently working with Sandra and Franklin to assist them in finding permanent housing. A painter, a Purple Heart recipient, an artist, a medical field worker, a writer. These are a few of the faces of those experiencing homelessness in Sutter County. Thank you.
Well, thank you, Robert and Ymelda. So it's interesting when you can see who the homeless are or were, and they're just like the rest of us. And the action that this board took back in January, here's a sample of the dividends from that work. The goal is to ultimately get everybody out of this vicious cycle and have not just dozens but hundreds of success stories.